So, generally speaking, college students are a pretty healthy bunch. In fact, 90% of students responding to the National College Health Assessment last year said that their physical health was good, very good, or excellent. So even though that's true, you're not going to be surprised when you hear that about 17% of those same students reported that getting a cold or the flu or a sore throat sometime in the last year affected their academic performance. None of you have had this experience, right? I know, I've seen some of the snot that runs on this campus. So if you add ear and sinus infections, strep throat, bronchitis, the number of students whose academics suffer goes up to 22%. And add injuries, allergies, and chronic health problems, and close to 30% of you had your academic progress negatively impacted in the last year. Seems like a lot, right? 30%? Until you remember what I said last week. In the past 12 months, 1 in 3 college undergrads felt hopeless or so depressed they couldn't function. That's 33%. And if you add anxiety and grief, that takes it up to over 40% of you having academic trouble. So what are all the numbers about? What I want you to know is that mental health problems and mental illness are just as real and having just as much negative impact on you and your classmates as any physical illness or injury. In fact, in most cases, worse. And unfortunately, unlike when you get a sore throat or bronchitis and you go to the health center or your doctor and you get some medicine, and then you crawl in bed with a hot cup of tea or some chicken soup and you get lots of sympathy from mom or your roommate or maybe boyfriend or whatever. Unlike that, when a college student gets depressed or experiences a panic attack or is even thinking about killing themselves, they don't usually talk to a counselor or the doctor. Very few people offer them tea and sympathy, even when they can't get out of bed for days at a time. Why not? Well, the bottom line is fear. Plain and simple, what we don't understand, we're afraid of. And that's why there's a stigma around mental health issues. But like I just said, mental health problems and illnesses are just as prevalent and sometimes worse so than any physical illness, cold, flu, bronchitis, whatever you're dealing with. So my goal in the next few minutes is to help you understand just a little bit about those things, and hopefully in a way that we can all take better care of ourselves and each other, because that's what this is about. So here's some things you should know. Loss of interest, loss of motivation, fatigue, lack of energy, confusion, trouble thinking clearly, trouble concentrating, feeling irritable or angry or self-critical and blaming yourself, or feeling sad or stuck or hopeless, or for some, thoughts of suicide or death. These are all signs and symptoms of depression. Half of the people who have an episode of depression at some point in their life will never have another one. That's the good news. Unfortunately for the other half, they'll have more than one. And here's the scary thing. Those odds are worse if your first episode, your first battle with depression happens when you're young. And that's why getting help and the right treatment is so important. Because with that, you improve your odds. The reality is that we don't know all the causes of depression. Some that we do know are anytime you're faced with a distressing or uncontrollable or frankly traumatic event. All you have to do is turn on the news. That'll give you some examples. But many of you have had those personally. A death in the family, failing a class. These are sometimes distressing, sometimes uncontrollable, although sometimes you had something to do with that, but you get the idea, right? They're distressing, difficult events. It could be something that you experience now in the present time, or those events could have happened in the past, in your family or in your childhood. Sometimes we respond to those a lot later in life. There's no rhyme or reason, it just happens. Any stressor that is constant or ongoing, that kind of never goes away and wears you down, can trigger depression. And for some, we know that your brain neurochemistry is the culprit. And that's why for some, medication is the right treatment to help them feel healthy and productive and get on with life. So I know this is true because I have people ask me this all the time. For any of you who've never struggled with depression, the idea that someone is in so much pain, emotionally speaking, that they'd rather die than go on living is a little hard to imagine. So I just want to give you a little more information about that, because I think it's important to know why. Most people who are depressed and thinking about suicide aren't really set on dying. That's not the issue. That's the solution to the problem. The problem is the pain. The problem is the hopelessness, the desperation, the feeling like there is no way out of this. Unfortunately, as we all know, death or suicide is an answer, but it's not the right one. Because recovery is possible, help is available, getting better is available and able to be done. You just have to connect to the right help, the right treatment, the right support. So it's important, I think, for you to know that, so that if you're ever in that place where maybe you're feeling so depressed, so desperate, so despairing that it's not going to get better, and you have those thoughts. And by the way, that's probably one of the most common things that happens. Just know that just because you're thinking that doesn't mean you have to do anything about it. It's a thought. We have lots of thoughts that we don't act on, right? Hopefully, that's sometimes you're being, appropriate. Like right now, you're all being a good audience and listening, and you're thinking, is she ever going to shut up? So, but you're not doing that. You're not saying that. You're not coming out with that in the middle of this. So, just know that just because you're thinking it doesn't mean you have to do anything about it. We know, for example, that people who are feeling suicidal don't really want to die because 90% of those who are in a suicidal crisis, who are having that idea, usually tell somebody. They give warning. Why would they do that? They want someone to stop them. They want someone to tell them, I care about you. I don't want to lose you. I want you to be here. You're important. You're valuable. You name it. Unfortunately, the most likely response to somebody sharing, I've been thinking about suicide or I've been thinking about hurting myself, from family or friends, is silence. Nothing. I think you can imagine that's probably not very helpful to that person. People who are depressed or suicidal actually find relief in being able to share how it feels, especially when the person listening is accepting and non-judgmental. That's something we're called to be, right? With all this in mind, I want to give you just a few ideas about what to do and what not to do, whether that's you experiencing the feelings or if you know somebody who's depressed. And the first thing I just said is be an active, non-judgmental, caring listener. Right? I think far too often why we don't listen or why we don't engage with someone is because, again, we're afraid. We think, I don't know what to say, I don't know what to do, I don't know how to help this person. That's okay. That's not your job, right? All you have to do is listen, be respectful, recognize it hurts, validate the pain. Reassure them that you care and that you're concerned, and quite frankly, if they are thinking about suicide, that you want them to be here, that you value their presence in your life and in your world. That's important. I often tell people the way to respond in these situations is to be open and accepting of the pain, but unmoving in your conviction that there is a better answer. Right? I just said that help is available. Recovery is possible. Support can help you feel better. Solutions are out there. And even if you don't know what those are, that's okay. That's why when you came in tonight, hopefully you all got a card. Those are resources for where you can find that help. We can think or feel anything without acting on it, I told you that, and the right help and the right support can help anybody recover and move on with their life and maybe be part of that half that never goes through this again. But I think what we heard from Becky's story last week is that's not always the case. And so for those who are struggling and are continuing to struggle, they need us even more to be there, to be supportive, to listen, right? Because they don't get to get over it, they get to work through it. Here's some things not to do. Some of them are pretty obvious, but I'm going to share them with you anyway. The first one is, and I don't know, a lot of people maybe think this, so I'm going to dispel the myth right now. Do not be afraid to ask somebody, are you thinking about killing yourself? Don't be afraid to do that. I think a lot of people think if I bring it up, maybe that will prompt them doing it. Maybe that will make it worse. And we know that is not true. Not true. If you bring it up, that means it's okay to talk about it. Right? So do not be afraid to bring up the subject. Do it. Try not to obviously act shocked. You shouldn't, right? Now you're all in the know. You all know what's going on. And try not to bombard that person with all of your best solutions for how they can improve their life, right? We're all experts on somebody else's business, but, right? We want to tell you all about how to live your life. In this case in particular, resist the temptation, because that's not going to help them feel better. Try not to minimize the depth of the situation. Kind of the, don't worry, be happy. That's not usually very helpful. In fact, for some people, that can make them feel worse. Because the reality is, they've been trying to not worry and trying to feel better, and they haven't been successful. So if we just offer that as the solution, don't worry, it'll all be okay. That's going to be a problem. Try not to minimize the situation spiritually either. And by that I mean, you just need to pray, or just give it to God and let go. Don't get me wrong, prayer is awesome. We need it all the time. But sometimes these kinds of issues need both God's intervention and human intervention. So we want to make sure that people who need that can get that. You're not really trying to convince them of anything, that they don't want to die or that things are going to get better. Don't try and cheer them up. Don't say, funny things or think you're going to make it better that way, because again, that just might make them feel more ashamed that they don't feel better. And try to avoid this one. And unfortunately, I have to tell you, I've heard this more times than I can count in the short time that I've been here at Biola. Please, 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 resist chastising someone for having a lack of faith or a poor spiritual life. These types of emotional struggles and mental illness, mental health problems are no more a matter of faith than the bronchitis that you're still coughing from 2 weeks later. how's that possible? So again, try not to judge someone who's in this circumstance. The emotional distress that they're experiencing is real, and the best thing you can do is just care. And probably the last thing I'm going to say, and then we're going to open this up for questions, because I could talk on, and you don't want to listen to me. What I would really like to do is to hear whatever questions you have, and for Becky and I, and Becky's going to come and join me in just a second, to answer those questions, and just to take what we started here as a conversation and really open it up and talk about it. But the last thing I want you to hear me say is this. If someone you know is talking about suicide, thinking about killing themselves, and it seems that they're unable or unwilling to get help for themselves, do them a service and get help for them. Trust me, they will thank you. Okay, that was a downer, huh? So, Becky, come on up here. And as I said, we really want to answer your questions. So we're going to actually, I think, turn the lights up a little bit more. And we're just going to hang out up here. And we've got some folks with microphones, so you can grab a mic and...
Wait, is this on?
Is it on?
Nope, not on.
Did you turn it on?
Oh, do I have to?
Try that.
Technology is so hard.
Wait.
Got it.
Hey.
Nope, not on. Oh,
There it is.
there it is. So while you're thinking of your questions, something I was thinking about while I was over there in my thinking chair,
Excellent.
is I know like a lot of it sounds very like textbook, like do this, don't do this. But what I was thinking is like as we're called in this family of God, that there is such an empathy that we should always carry with one another, to watch your words all the time. Not just like when people you think are struggling, but just how vital it is, because we don't know what people are going through, which I know we've heard probably since we were 14 years old in like high school. But it's so true, and how much power we have to heal through our words, but also the power that we have to create demons with our words. So just a thought. So if anyone has any questions, you can raise your hand.
They will bring you a microphone.
Your very own mic.
All right. We have a brave person over here. Excellent.
Stand up. Okay, great. Hi, how are you doing? Okay.
Good. Sorry.
Sorry. So I was wondering how you would deal with the situation in which it's not your peer who is dealing with a mental health issue, but it's a parent, because it's a different dynamic, different relationship, and you can't necessarily approach it in the same manner. So yeah, how would you go about that?
That is a great question. Well, on the one hand, yes, it's different and the dynamics are different. On the other hand, it's the same in that all the things I said about the symptoms and the medical nature and the treatment that's needed are all true, no matter what age you are. So if you have opportunity to do what I said, which is be caring and understanding and non-judgmental and try to encourage that person that there's help available and solutions, great. But you may not be in a position to do that because that's your mom or your dad or whoever. So you may need to rely on other peers of that person to get involved in that process. And I think you have to sort of determine who's the best option, but obviously getting treatment is necessary. It's just a matter of how to make that connection.
My mom actually has clinical depression, and she's had it since I was super, super little. I just didn't know what that always meant. And the story she told me later on in high school was there's a night that she attempted suicide, and I walked in on her. I don't even remember this. I don't remember like what she was doing. And she just broke down and cried, and she realized that she was a mother and that she had something to live for. And so I think I'm not a parent, but But talking to my mother, I think reminding her that like she had her worth in Jesus as this role of a mother was really, really vital for her. So I could not communicate that as a 4-year-old, but there is something powerful with communicating the worth of a child to their parent.
Mm-hmm. Yes. What else? I see a hand.
What would you tell to a non-believing friend who struggles with depression and says things like, I've been praying and praying and reading my Bible, but God's not answering in my prayers and I still feel like ending it?
Join the club.
I knew that was coming.
I guess I've talked to a couple people who've dealt with it, who are unbelievers. And so I guess a lot of it is that I tell them that it's not prayer that takes these away. And if you were here last week, I talked about how it's not supposed to go away, but with Jesus it's redeemed. And so honestly, I can't give you a spiritual answer on how to deal with depression if Jesus is not involved. So there's obviously like help that's needed, but I think that the only way that depression, anxiety can actually start being used in a way for good is if Jesus redeems it. But I'm sure there's other options.
Well, sure. I'm going to agree with that. I think for the Christian, that's the beauty of our relationship and the beauty of grace. But I think for someone, your friend who's not a believer, 2 things. You can be that grace for them, right? We are the embodiment of Jesus, so you can be that grace for them and try to help them experience what it's like to have that unconditional acceptance and love and mercy and compassion for what they're going through. And the other things that I said, which is, and there's help available, and I would be asking that person, what kinds of things have you been doing? Have you been in treatment? Have you talked to a counselor? Have you seen a doctor about medicine? I mean, what are the steps that you've already attempted? Does that help? Great. Who else? Ooh, couple down here. And one back there, too.
Do you have any advice on how to help someone dealing with grief?
Well, sure. Well, the first thing is, I'm taking a page from Becky's thing last week, which is, that hurts. I think we just have to acknowledge, grief is painful. I'm about to get misty because my mom passed away just a few weeks ago. Now, she'd been ill for a really long time, and frankly, death was a release for her from pain and a lot of things. And still, it hurts. There's no way around it. So I think in the same way we talk about depression, just know that it can get better, and it does get better. The good news with grief is that for most people, time alone heals. That's what we know. So you just have to give yourself time. But there's more you can do. Talking about it helps. It relieves the pressure. It kind of unloads it for you. Being with others who are having the same experience. That's why grief support groups are so effective. People really get benefit from just knowing, I'm not alone. Now, there's other people who are having the same experience that I'm having right now. Those are some thoughts. These are great questions. There was another one, I think, right here. And was there one back there? Did we get a mic going that way?
So what advice would you give to affected friends and family to look after their own mental health amid all the turmoil?
It's the self-care question. I like it. Well, I often talk to people about, kind of mental and emotional well-being and well-care. in relation to physical well-being. So if somebody asked you, what are 3 things you need to do to take care of yourself physically, what would you say? Sleep. Thank you, somebody. Sleep. Everybody hear that? Sleep, right? Eat nutritious food and do some kind of exercise, right? This is not rocket science, right? So there's sort of the same kind of, okay, so that's the foundation. What I can tell you is that a lot of mental health struggle can be resolved by a really good night's sleep. And when you are sleep deprived, you are much more likely to suffer from, make the list, anxiety, fear, you name it. So start with sleep. If you can do nothing else, get some sleep. I'm going to say that one more time because this audience is notorious, right? Sleep, it's important.
I think something else, this might not make sense. Just give it a shot. To know that if you're on like the early onset, you're like, oh man, some of these things kind of sound similar to like things that I've been feeling, but I wouldn't say that I'm like clinically depressed. I think that there's going to be a huge difference in our generation too, to know that there is help, and so you can start talking about it very early. Again, the longer you keep things inside, like the more it just is like a poison to your soul, and it will only increase the hurt and the pain and the feeling. And so the sooner you can start talking about it, even if you don't think like, I'm crazy, just the first moment where you're like, man, I'm really feeling bad about myself. Knowing that there's a community that exists that like wants to talk about it with you is super vital, super important.
Absolutely, she's right. Early intervention, prevention, start to recognize for yourself when things feel overwhelming, and don't wait, talk to somebody. Ask for help. Share with a friend. Always invite someone into whatever you're struggling with. That will help keep things from getting out of hand. Was there one? I can't really see, but okay, go ahead.
How would you, I'll just say, my brother has Asperger's syndrome, and he's also considered suicide. So I guess, what advice would you have for me as a sibling
Sure.
in that relationship of, and with Asperger's, because the social aspect is going to be different there.
Right. It's very difficult because, and for those that don't know, Asperger's is on the autism spectrum. So there's some neurological things involved that really prevent this person from having some of the same social connections that you and I might have. So it's hard, I think, to do that kind of personal caretaking, because it may not be well received. But I will say this, but we know that persistence and consistency in a caring, calm, I'm here for you kind of approach works. It may not solve everything, but it does tend to make persons with autism or Asperger's feel more calm and able to kind of do whatever they're capable of. So, I would say just be there, be present, be a caring, concerned kind of presence to the best of your ability, and just recognize the limitations. But I would also say, because that person struggles in a way that is going to make it more difficult for them, I'd be extra cautious, extra careful, extra making sure they're kept safe, those kinds of things. Yeah. I see a hand back there. You have a microphone for that person?
Basically, what advice would you give to a person for whom depression is the base struggle, and it has spawned for example, an addiction or a struggle with self-harm or some other important issue?
Well,
You want to start?
sure. I'll take a swing at it. I don't know. We'll see. I think when things start showing up in such a physical way, we can say that like prevention is really great. But if we're being honest, a lot of times it gets to those severe places before we start realizing that we or someone else has a problem. And I would say in that time, get to counseling as soon as you can, which sounds like a quick fix kind of answer. If you've ever been to counseling, you will realize nothing is quick fix about counseling. It's a everyday healing process. And so when things start showing up in such a tangible and demonstrative way, you or like the person that you know needs to seek help beyond their own means and the means of their family.
Mm-hmm. And I would say, I think, I mean, Becky's on it, that those are signs, obviously, of things getting worse. So that just means the need is greater and help is more important. But also, just recognize that when you've got multiple things going on, you can't tackle it all at once. So what I would say, if somebody was coming and seeing me and asking for help, then we'd sort of prioritize those things. First things first. I can tell you, first things first, the first thing in that scenario that you described is the substance abuse. You got to be sober to get healthy. So that's the first thing we got to deal with. And then obviously if somebody's life is at risk, if they're harming themselves in such a way that they could really put themselves at risk, you got to deal with that. So we just have to take things one thing at a time.
There's a hand here. I think we have like time for maybe like one or two more questions.
Yeah.
I have a friend who struggles with depression and anxiety, and I've struggled with it too in the past a lot. But me and her have a lot of conversations and a lot of arguments, because I'm not sure if she's a believer, but she believes in God, she believes in Jesus, but she's not, she has a very secular worldview, and she has a lot of problems with what the Bible says. But I have a lot of arguments with her because she believes that medication is going to fix her for the rest of her life, that her anxiety and her depression are just a chemical imbalance in her brain. And if she's on the medication, that will fix it, and that will fix everything, and everything will be perfect. And for me, my depression and anxiety has been a struggle, but I also see it as a way for God to communicate with me, or if there's a problem that I need to address, or it's helped me a lot to acknowledge and go deep and
Sure.
dive into that and see and figure it out. And so I'm very wary of medication because I've seen it do a lot of harm to people. Trying to cover up, trying to numb out what's really going on. So I just wanted to get your perspective on that and what you think about that.
Sure. Well, I mean, I think the reality is that medication as a treatment for mental health or mental illness is part of the practice of medicine, just like different antibiotics are an attempt to practice medicine against infection. What we know is sometimes it works, sometimes it doesn't. Sometimes it works for one person, but it doesn't work for the next person. And that's, frankly, from my perspective, that is evidence for the fact that we are complex, created beings that are unique in every way, and one fix doesn't work for everyone. So, I mean, I think that's something just to, know that one answer or one pill is not going to fix everybody's problems. So I think we have to be cautious. On the other hand, what I can tell you is, for fear, I think, far too often of that medicine is, going to numb me out or make me a zombie or whatever, that people avoid or don't take advantage of medicine. And the way I look at medicine is one more tool that we have to address these kinds of issues. What you described about going deeper and examining yourself and listening to God, those are other tools that you're using. I, frankly, would like to be able to use every tool possible because I don't want anybody to suffer in any way. So I'm gonna start with whatever's, kind of readily available, which might be conversation and understanding and strategies and better ways to kind of get through the day. And if that's not working, going deep might really be a great tool. And if that's not working, medicine can be a great tool. And what I can tell you about medicine today is we have far more choices with far less bad side effects. And for lots of people, and I've had this happen, they might struggle and struggle and struggle, kind of beat their head against a wall, doing everything they can to feel better and get better, and not really get anywhere. They try a medicine, and I've heard it over and over. It's like, I'm myself again. they have this somewhat miraculous feeling of being recovered. Does that stay that way? Not always. Sometimes that's the beginning of the healing, but all the things you're talking about need to go with it too.
Do you want to announce this
Yes.
as we wrap up?
It is time. Okay, so this has been great. Thank you so much for asking your questions and being involved. And we want you to know that, again, this conversation has just started. There's a lot more to talk about. So we just want you to know that's open to you. That's an option. One way to do that is, I'm just going to give a little plug here. This is a flyer. There are lots of them near the exit on the way out, and I have a stack up front here if you want to come see me. You can be trained in mental health first aid. This is an 8-hour certification course, and I'm going to be doing this class a weekend, Friday night and Saturday morning in May. It's free to come, and I'm going to feed you. So if you're one of those people that just has a heart and really wants to be supportive and have the right tools, this is a great way to do that. So I invite you to join in.
So I guess the last thing, the band is going to come up, and we're going to change things a little bit tonight. We're going to do 3 songs kind of right in a row, and the After Dark team is going to be here, as well as Michele and myself. If you have any additional questions, or just if this has been something that, if you've been here for the past 2 weeks, is really, really like heavy on your heart for yourself or for someone else. And last time, I don't remember what challenge I gave you, for being 100% honest. Just kind of randomly made that up off the top of my head. And so this could actually be the same thing I challenged you with last week, but as I was thinking as I was driving over, there's so much beauty in the kingdom of being seen. And so see others, because that's what we're called to do. There are so many people on this campus alone, but in this city by itself, that are struggling with things that you might never know. And how beautiful it is that we might have the ability to speak into their lives truth of hope, of Christ, of love. And being a part of that circle is amazing. I've been able to hear some of your guys' stories for the past week, and it's been the most humbling and biggest blessing of my life this past week to be able to connect with you guys. But continue to share those stories. I love hearing them, but I promise you your roommate is going to love it too. That the person in your hall is going to love it, and they might actually really need to hear it. A lot of your guys' questions were actually very similar to stories that I heard this past week. So there's other people that are in this room that are struggling with the same thing, and if we could just open our eyes to see one another, we could do this thing a lot better if we're together, which again, I know we've heard for a long time, but we're not really great at grasping it. Mm-hmm. So let's just do it. Let's just open our hearts, be a little vulnerable, get a little hurt, and then just heal. So the band will go now or something.
We hope you enjoyed this message. Biola University offers a variety of biblically centered degree programs, ranging from business to ministry to the arts and sciences. Learn more at biola.edu.